across so many milestones in this journey. Initially, we had very few cases, but a lot of fear. Everyone was scared. Slowly, the number of cases increased, but the fear started coming down. Probably the awareness and people are getting used to it. Nobody realized that this would be such a big pandemic. It's a huge pandemic. And it has affected all countries in the world. It has affected all climates. Now, initially, there were lots of mortalities, but gradually, the virulence of the severity of the virus has come down. The recovery rate increased, hospitalization incidence reduced, home quarantine options increased and accepted. The initial strict lockdown now gradually relaxed. One thing we realized that COVID-19 is not a simple epidemic. We cannot take it lightly. We have to be cautious, careful, and observant till the pandemic gets over. Now, when this pandemic will get over, nobody knows. We don't know. We also do not know that when the pandemic will get over, will the virus will go, or will it still remain with us and cause further infections? But we have realized that undue fear of COVID is gradually reducing. People are getting bolder. People are understanding the situation. Now the question is, should we wait for coronavirus to go, or should we learn to live with it? It's a big question mark. And I would say it's an individual perception. But gradually, we should continue our regular activities, our work with certain limits and precautions, of course, under government guideline. Now, most important thing, we have experienced that our regalia has done splendid job and fought well with corona episodes in our society. All regalians have shown courage and humanity. I remember very well that first incidents of corona started from my home in our society. But all of you have supported us very well, and same support was given to all the families, all the houses affected later. I would love to mention the names, but it would be injustice to others if I mention only few names. So big thanks to all of you, all regalians. Whatever said and done, few factors remain constant during this changing statistics and changing scenario. And a constant factor is precautions. Precautions, precautions, precautions. Now there are certain precautions I would like to tell which we should follow. First is hand hygiene, the regular hand wash, preferably with the soap and water, as it is more effective than sanitizer. And whenever soap and water is not available, then proper use of sanitizer should be implemented. Second important thing is social distancing. It's very important. It is said that 1 meter or 3 feet distance from others would be very effective in preventing or minimizing the spread of infection. It has been seen that close contact for more than 10 minutes with a COVID patient or COVID carrier can spread the infection. Hence, minimizing the contact period to less than 5 minutes would be helpful. If you're talking to someone who is unknown to you, who is from different place, better curtail your discussion and contact period to less than 5 minutes. Third important thing is wearing mask. 3-layered mask is preferred and is effective. We should wear mask in social place or when in group. It will protect you as well as others from getting infected. Fourth is avoid contamination. Very important and very common thing. All of us know by now that contamination of our hands with the infected droplets lying down on various surfaces like table, doors, hand knobs, common toilets, common places like lift, entry gates, shops, etc. Repeatedly touching the face with the contaminated hands would cause the infection. And to avoid that, wash or sanitize your hands before and after touching such places. Avoid touching face or mask again and again. Wherever required, wear gloves, but then don't touch your face with the gloves. Proper disposal of gloves and masks is very important. We should not keep gloves or masks just on the table or somewhere else, because again the surfaces will get contaminated with the external surface of that. Fifth important thing is looking for the symptoms of the disease. We have to be very observant. Fever, cough, breathlessness, shortness of breath are classical symptoms of corona, but they can occur in any other illness also. But you have to observe anybody in our family or any family member is having these symptoms or not. And there are some uncommon symptoms like loss of taste, loss of smell, loss of appetite, severe tiredness, extreme fatigue, loose motions, severe body ache, severe neck pain, throat discomfort. All these are misleading symptoms, and we may not suspect COVID, but these are the symptoms which are notified in COVID disease. Increased pulse rate more than 100 per minute and reduce oxygen levels less than 93% in asymptomatic person. These things are alarming. Recognizing these symptoms and immediately informing your family members and your doctor is very important. Early treatment matters. Sixth one is self-care. Good food, adequate rest, avoid stress, warm and salt water gargling, steam inhalation, immunity boosters like vitamin C, vitamin B12, vitamin E, vitamin D, zinc supplements, and home remedies will be always helpful. Being careless about COVID would be dangerous. Definitely we have to take it seriously, but reducing fear of COVID is very important. We have to be cautious and alert. Maintaining preventive measures is very important and is the ultimate important thing in preventing the COVID. Now we have noticed that despite taking extreme precautions, some people still have got COVID infection. That is very unfortunate. We can say that is a destiny. We don't know where the things went wrong, but still the mainstay to stay safe is preventive measures, all precautions. Now, last few weeks, we have noticed that severity of the disease seems to have come down. The death incidence is stabilized. Home quarantine cure incidence is increased. All these are good signs, and hopefully things would improve in future. And I think it's a time to understand Corona, fight with Corona, and I think we should learn to live with Corona. I wish you all good luck and good health. May God, may Swami bless us with the good health. Stay safe and hope next Independence Day, we all gather together in our favorite Northwest corner to celebrate our next Independence Day. Thank you very much. Jai Hind. Thank you.
Thank you, Dr. Rajesh Gagre. It was really golden advice by you. I think it was a blessing for all of us that we have Dr. Rajesh Gagre staying in our premise, sharing his golden thoughts. I hope everyone has taken note of it. And for those who have missed it, we have done